Hello, my name is Thea Echevarria, and I am an undergraduate public health student at San Jose State University. And today I'll be talking about the association between loneliness and suicide ideation among college-aged adults during the COVID-19 lockdown. Today we'll be looking at the research question, is there a significant connection between loneliness and future indicators for suicide ideation in young adults? For a little background, the unprecedented lockdowns of the COVID-19 pandemic have vastly increased the mental health burden of the population due to prolonged isolation. Particularly, the young adults who were already experiencing a disproportionate burden in mental health have had to continue with their responsibilities and expectations in education, work, and familial duties, which can all act as major stressors in a person's life. The student and faculty partnerships of the study examined loneliness as a symptom of mental distress and its path to suicide ideation, and analyzed ways of prevention through the value in coping mechanisms. The methods to implement this research. We conducted a cross-sectional study representative of the young adults ages 18 to 35, social networks of San Jose State University students in October 2020, about 8 months after the start of the beginning of the lockdown. Our survey assessed demographics, mental health outcomes like the presence of anxiety, depression, and suicide ideation, and the use of common coping mechanisms. The survey takers were able to categorize their answers by using valid and reliable scales of time developed by students based on their lived experiences during the pandemic to measure severity. The results of the survey had 358 young adults as a sample population. The scales that were used measured length of time of mental distress within a 2-week period, and you can see them distributed here on this bar graph. The blue represents the number of participants that did not have feelings of distress at all, while the other side of the graph, the yellow, are participants that are experiencing these feelings every day. The survey in total showed that 39.7% reported some degree of anxiety, 30.8% reported depression, and 17% reported suicide ideation. When just looking at loneliness and suicide ideation, we'll see that the number of participants go down as the number of days increase. But if we were to examine the prevalence of participants feeling both loneliness and suicide ideation, we'll see that for each increasing level of loneliness, the risk of suicide ideation was higher. And finally, when looking at different coping mechanisms that are being utilized by each participant and comparing it to the degree of loneliness they reported, we are able to see that students who reported high levels of loneliness were less likely than their peers to report coping with the pandemic by connecting with friends or family or having connections through employment. These students had a higher expectation to report coping by watching TV and sleeping. So in conclusion, through the research, we were able to understand that loneliness is both a symptom of mental health distress and an exacerbating factor that could lead to signs of suicide ideation, and the possible coping mechanisms that could be employed that would help alleviate those feelings. So what does that mean for us, and how does this apply to human rights and social change? By understanding communities at risk, we can implement intervention practices and programs. For young adults in this study, our understanding of loneliness and how it can be a leading factor towards suicide can create a call to action for health professionals and families to apply early prevention through encouraging an increase of social connectedness practices during and following after the COVID-19 lockdown. Thank you for listening to my presentation, and I would like to thank my research team and our professors, Dr. Park and Dr. Worthen, for their encouragement and guidance. I would also like to acknowledge the Fall 2020 epidemiology course involved in the study, as well as the Thoracic Foundation support. Thank you.